Here are some USMLE-style questions on Metanephros, the final and permanent kidney in human development. Question 1. A 12-week-old male fetus is found to have bilateral renal agenesis on ultrasound. This condition is most likely due to a developmental failure of which of the following embryological structures? A. Ureteric bud, B. Pronephros, C. Metanephric mesenchyme, D. Mesonephric duct, E. Cloaca. Answer A. Ureteric bud. Explanation. The ureteric bud interacts with the metanephric mesenchyme to form the metanephros, permanent kidney. If the ureteric bud fails to develop or interact properly, the metanephric mesenchyme will not differentiate into nephrons, leading to bilateral renal agenesis. Question 2. A 3-year-old boy presents with hypertension and hematuria. Imaging reveals small, hypoplastic kidneys bilaterally. Genetic testing confirms a mutation affecting the development of the metanephric mesenchyme. Which of the following conditions is most likely? A. Autosomal recessive polycystic kidney disease, ARPKD. B. Renal dysplasia. C. Multicystic dysplastic kidney. D. Potter sequence. E. Wilms tumor. Answer B. Renal dysplasia. Explanation. Renal dysplasia occurs due to abnormal differentiation of the metanephric mesenchyme, leading to disorganized kidney tissue, small kidneys, and cyst formation. It is a common cause of chronic kidney disease in children. Question 3. A newborn presents with oligohydramnios, limb deformities, and pulmonary hypoplasia. The kidneys are absent on ultrasound. This condition results from a failure of which of the following processes? A. Formation of the mesonephros. B. Development of the metanephric mesenchyme. C. Induction of the metanephric mesenchyme by the ureteric bud. D. Fusion of the ureteric buds. E. Apoptosis of the cloacal membrane. C. Induction of the metanephric mesenchyme by the ureteric bud. Explanation. Potter sequence results from bilateral renal agenesis, which occurs due to the failure of the ureteric bud to induce the metanephric mesenchyme. This leads to an absence of amniotic fluid, oligohydramnios, causing characteristic facial and limb deformities and pulmonary hypoplasia. Question 4. A 4-year-old girl presents with a palpable flank mass. Histopathology reveals a tumor composed of blastemal, stromal, and epithelial components resembling metanephric tissue. A mutation in which of the following genes is most commonly associated with this condition? A. PAX2, B. WT1, C. TSC1, D. VHL, EAPC. Answer B. Explanation. Wilms tumor, nephroblastoma, is a pediatric renal tumor that arises from the metanephric blastema. It is associated with WT1 gene mutations on chromosome 11, which plays a role in normal kidney and gonadal development. Question 5. Which of the following statements regarding metanephric kidney development is correct? A. The pronephros contributes to the final functional kidney. B. The mesonephros forms the adult kidney. C. The metanephros begins functioning at 4 weeks of gestation. D. The ureteric bud gives rise to the collecting system. E. The metanephric mesenchyme forms the ureters and renal pelvis. D. The ureteric bud gives rise to the collecting system. Explanation. The ureteric bud develops from the mesonephric duct and gives rise to the collecting ducts, calyces, renal pelvis, and ureters. The metanephric mesenchyme forms the nephron, glomeruli, PCT, loop of Henle, DCT. Would you like more practice questions?